erythromycin, macrolides. L-linezolid. ऐसा याद रहता है बहुत difficult. Is iron याद है. Just amphetamine chloroquine amphetamine paracetamol. Amphetamine sorry. Amphetamine minus salicylic acid. Levoanisine. Paracetamol और N-acetylcysteine. Acetaminophen. Morphine, naloxone. Narcotics, opioids,
Suresh.
Cyanide, sodium 5-cyanide, sodium 5-sulfate, sodium nitrate.
Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. So in our long journey of the previous year questions, PYQs of NEETPG, it is going to make a lot of difference in your preparation if you know what is the pattern of examiner and what are the questions and topics that you need to master every day. So thanks to Diksha, Mithuna, and many more who are all online. Can you please punch whether the voice is loud and clear for all of you, Doctor? Nice to see Sanvita Reddy and many more who are all online. Good. So, Doctor, let us take up 2017 question paper. Quickly run through 200.
So, why are you insisting on?
Huh?
2017 paper insisters.
That was made ready. 2022 में first 100 questions we finished.
So second 100
करेंगे यार हम मैं नहीं जाऊँ. After okay first 100 इसमें खत्म करके we'll switch over. Now let's see some repetitions. Yeah, all right. कैसे भी ये भी करना पड़ेगा. Good. So, doctor, what is the type of muscle which is being shown?
Multipennate.
It is fundamentally multipennate. This comes under biscuit question. Branchial arch derived from. So once more, लिख लेना. Two topics: pharyngeal arch derivatives. Branchial arch derivatives. Second is ectoderm, endoderm, mesoderm derivatives.
So arches and pouches.
Pouches derivatives. उसका first arch में what is the muscle like seventh cranial nerve, stapes. All these are the second pharyngeal pouch like that. The table को master करना है आप. Similarly, ectoderm, endoderm, mesoderm, neural crest derivatives is a very standard topic you should remember. So the nerves are derived from the neural crest is what you need to remember. Now, heart palate, what type of epithelium is it? It is a keratinized epithelium and it has submucosa and also minor salivary glands. Then what is the tensor of vocal cords? Once more, everything about the vocal cord muscles is a standard MCQ every exam.
So muscles, vocal cords and supply, larynx.
Vocal cord, muscles and nerve supply. All muscles are supplied by recurrent laryngeal nerve. Only you need to know what is abductor, what is adductor, right? Which is the tensor, and what is the function of cricothyroid, and what is the nerve supply of cricothyroid, which is the only one which is not supplied by recurrent laryngeal nerve, but by
External,
superior laryngeal nerve's external branch,
cricothyroid.
cricothyroid, which is basically the tensor. It decides the pitch and quality of our voice, is what you should remember. Ureteric bud develops from. So this is favorite question. Is there anything new about it? No. Metanephros, mesonephros, definitive kidney develops from where? Mullerian ducts, all genitourinary embryology. Mullerian, Wolffian duct liklo. Mullerian, Wolffian duct and its derivatives. Dermagaram padna hai. So it is typically the mesonephros from which the ureteric bud develops from. Is this any new question? No. This also standard topic. What is that? Weber, Benedict syndrome, Claude syndrome, North-Nagel syndrome, Fovili syndrome, Fovili, Weber, Benedict, Claude, North-Nagel. One MCQ invariably comes. This is the standard topic: brainstem stroke syndromes. Brainstem stroke syndromes. Every entrance में NEETPG के एग्जामिनर के क्वेश्चन बैंक में बैठा हुआ है. So वेबर का होता है, मिड ब्रेन का इन्वॉल्वमेंट होता है. So मिड ब्रेन लेवल पे did the corticospinal tract decussate? No. So that's the reason if the left is involved, the left corticospinal tract ultimately in the medulla go to right side. So contralateral hemiplegia. Midbrain is the place where you have oculomotor nerve, so oculomotor nerve palsy, and it lead to contralateral Parkinsonism. So all these are the features. Simpson's fascia. Red light area question. Right? Don't touch it. Because it is difficult. Somebody reads Simpsons and go. It is not in the regular one. You know it good. It covers apical part of the lung. It's a part of the scalenus anterior and the vessels pass above the fascia. But what is standard topic? Clavipectoral fascia. What are the things that pierce it? That is a very standard one. Colles fascia in the abdomen is a standard one, not a Simpson. So this is once more a red light area question. You try it, you lose it. Thrombosis of pica, Wallenberg syndrome. Cheap chitka question, biscuit question, standard. 1 out of the 100. Last time రాసుకున్నారు కదా, పైకా, ఐకా, ACA, PCA, MCA, all these territorial strokes and lacunar stroke. One MCQ every NEETPG, one question आएगा. आज रात ही आप इसको मास्टर करें तो आपके पॉकेट में 1 मार्क हो जाएगा. Very nice to see. Amita Union, Dog Girl, Shivanarayan Rao, Afros, and many more who are all online. Can you please punch? So once more, doctor, I want to tell you what is our terminology. We have a special terminology here. 50 are biscuit question, otherwise called chiller questions. आप इसके लिए प्रिपरेशन का जरूरत ही नहीं है. आपके पूर्व जन्म के ज्ञान से आंसर करोगे, कोई भी आंसर करेगा. 50 are red light area questions. Don't touch it, don't look at it, don't think of them. Otherwise, you'll get negative marks. 100 MCQs are standard. Understand? Like Diwali cracker, standard. Ek Wellenberg, एक वेबर, एक नॉर्थनगल, एक फोविली, एक फेशियल नर्व पैल्सी, डिफरेंस बिटवीन यूएमएन एंड एलएमएन टाइप ऑफ फेशियल पैल्सी, ऑल दीज आर स्टैंडर्ड. इसमें कुछ गड़बड़ हो गया तो गॉन. सो 100 + 50, 150 आ गया तो 600 ड्रीम स्कोर आ गया तो आप तारे सितारे बन जाओगे, राइट? So that's the reason, doctor. So it is lateral medullary syndrome. Broca's area is situated in another biscuit question. I mean standard question, not biscuit. Biscuit bole to alag rehta. Very easy. So inferior frontal gyrus is Broca's. So please once more write in your list Broca, Wernicke, conduction, the 3 types of aphasias. And what are the differences between them? Where do you find repetition? Where do you find jargon aphasia? Where do you get agrammatical aphasia? Everything you should read. Right, doctor? We discussed also. So what is the function of the muscle which is being shown? So fundamentally, what is that?
Flexion and metacarpophalangeal.
Flexion, right? Good. So lumbricals, interosseous. Every NEETPG you go lumbricals, interosseous. Kuch bad action. దీనికి కూడా ప్రాబ్లం ఏమో వచ్చేసింది. Lumbricals, interosseous. Interosseous में dorsal and palmar interosseous. What is their nerve supply? What is their action? Sure shot MCQ. अगर कोई आंसर नहीं करे तो गया. Acute tonsillitis affects which nerve?
Acute tonsillitis. Glossopharyngeal.
Good. Very standard question. Tonsillitis. Without that, there is no question paper. Quinsy tonsillitis. Which structure passes through aortic opening?
Aortic is not passing.
Not passing.
Vagus.
So it is Tata. Aortic opening से क्या जाएगा? Thoracic duct, esophagus, thoracic duct, aorta, and esophagus pass through aortic opening. Aata. Tata नहीं आटा. आटा. चपाती. This is what? Red light. समझ में आ गया ना? अभी आपको मजे में जाना, एग्जाम को टेंशन नहीं लेना. नस्मित, नजरत, नसरुद्दीन शाह, मेम्ब्रेन, किसी को भी मालूम नहीं होता. आप टेम्प्ट करके कुछ करने का कोशिश करें तो गन. What should be the value of the BMI below which it is lethal? मैंने बोला ना, इसके पहले भी आया एनोरेक्सिया नर्वोसा में. This is a standard topic, doctor. Standard. Anorexia nervosa, bulimia nervosa. Without that, there is no question paper. हमारे 1200 pages notes में 50,000 high yield facts हैं. उसमें आपको ये सब बातें मिल जाएगा. I don't know, puberty onset. Which receptor is blocked in myasthenia gravis biscuit? Estel. Next exam में पूछेगा Eaton-Lambert syndrome में which receptor? Which channel? Correct. Calcium channel, voltage gated, presynaptic. So myasthenia gravis and Eaton-Lambert is decliner. Standard. Everything, anything you should know. One favorite question of examiner.
Unknown caller.
The favorite question of the examiner is myasthenia gravis may. How is the deep tendon reflexes? Typically, they are normal. Whereas Lambert-Eaton syndrome, presynaptic hota hai, it's a part of element. That's the reason there is a eriflexia, is what you should remember. What is the characteristic pattern in Brown-Sequard syndrome? Brown-Sequard is hemisection of the spinal cord, contralateral loss of pain, then ipsilateral loss of sensory function. Is wrong. I mean, what is characteristic? Contralateral loss of pain only is characteristic. Nothing else is characteristic.
It is depreciating on one term.
You have cut the right half.
Yeah.
Right half ka pain temperature is going to go immediately to
Dorsal column.
it is going to go to the opposite side.
So dorsal straight by
Dorsal is straight. ये क्या रहता है यहाँ फॉर एग्जाम्पल राइट साइड में क्या रहता है लेफ्ट वाला फाइबर्स रहता है पेन एंड टेम्परेचर का सेम साइड का डॉर्सल कॉलम रहता है सो दैट इज द रीजन पेन एंड टेम्परेचर द ऑपोजिट साइड इज गॉन एंड इप्सिलेटरल विल बी द डॉर्सल जॉइंट पोजीशन डॉर्सल सब कुछ इवन मोटार फंक्शन आल्सो इज इप्सिलेटरल बिकॉज ऑलरेडी वो डेक्यूसेट होके आ गया और जब डिसेंड हो रहे हैं आप उसको रुकावट कर रहे हो मेडुला से ऑपोजिट का कॉर्टिकोस्पाइनल आ गया यहाँ वो जो लेवल ऑफ ट्रांसेक्शन में हियर एंडरहॉन्सल इज देयर नो दैट इज डैमेज्ड सो सेम साइड ना इट इज सप्लाइंग दैट मोटर एंडरहॉन्सल इज सप्लाइंग सेम साइड ना राइट वाला राइट को ही सप्लाई कर रहे हैं राइट डैमेज हो गया तो ipsilateral motor function loss, ipsilateral joint position and joint and position, contralateral loss of pain and temperature, Brown-Sequard. But this is a standard 1 in 100 questions. This is 1 in 100 wala standard Diwali. When is V by Q is infinity? Recently we discussed. Standard topic. Apex base V by Q. If the numerator becomes 0, V by Q become 0 by anything is equal to 0. When will, if the Q becomes 0, anything by 0 is infinity. So that is the reason what will happen?
No exchange of gas. Perfusion is zero. No exchange of gas.
When there is no exchange of oxygen or carbon dioxide at all, because of the perfusion became blocked. No, nothing is coming to exchange that particular alveolus. Then V by Q become infinity. Once more, JVP. V by Q लिख लिया ना ऑलरेडी हमने डिस्कस भी किया जरा एक मर्तबा उसका एक व्हाइट वॉश दे दो नाइस टू सी नेहा गौतम कामिनी अमिता एंड मेनी मोर हु आर ऑल ऑनलाइन डॉक्टर सी वेव एक रॉन्ग आंसर करे तो मैं जाके कहीं डूब जाऊंगा बोलो నిధి చాల సుఖమా రాముని సన్నిధి సేవ సుఖమా वो सब एग्जाम हॉल में बैठ के स्विमिंग पूल का तैरना बंद करना मितना जी
Isobolumetric contraction.
आइसोबोलिमिक कंट्रैक्शन लॉक किए जाए
Slow filling at the end of cards. इनका feeling आई थी.
See, A wave क्यों होता है?
It is atrial
Contraction.
contraction. Yes, sir.
Right? That time, what is this doing?
Pressure increase.
Relaxing. A wave के बाद क्या होता है? Exudation कई को होता? Relax हो रहे.
It is pushing the blood inside.
That time, ventricles start. Yeah, it should be. Answer should be A. You're right. Very good.
That's nothing but start of the systole.
Start of systole. ఏపా ఆన్సర్ తప్పేసిన సరే చెక్ చేయండి 18th క్వశ్చన్ కరెక్ట్ ఆన్సర్ ఏముందో ఒకసారి అయిపోయిందా మైండ్ అప్ చేశారా 18th క్వశ్చన్ ఏ ఉండాలి బి ఉందా ఎందుకు ఉంది చూడండి గుడ్ సో 1 MCQ will come on JVP. Are you all ready? Tomorrow exam. I'm proud that you did correctly. Isovolumic contraction. Alpha waves. 1 question come on EEG बोल के मैंने बोला ना. ओ अम्मा EEG लिख लिया ना इसके पहले ही लिखा नहीं लिखा. EEG कंपल्सरी अपा. Alpha, beta, gamma, delta. Sorry. Delta ఉందా theta ఉందా bat d gamma లేలే బీటా ఆల్ఫా తీటా డెల్టా ఉందప్పా గామా లేదంటున్నా బ్యాడ్ డే సో ఆల్ఫా ఆర్ సీన్ డ్యూరింగ్ రిలాక్స్డ్ యా ఎస్ very good. Gauri also said isovolumic contraction. Very good. But the point is क्या है ना आप रिवीजन बोले तो रिवीजन क्या है क्या मैं ईजी रिवीजन किया या नहीं एक पैराग्राफ 1 मिनट में क्या मैं जेवीपी रिवीजन किया या नहीं 2 मिनट में ऐसा रखना 400 टॉपिक्स को एवरी डे यू शुड डू 1 रिवीजन वो लेवल पे चले जाना उतना फोकस्ड बराबर जरूर आएगा बोले तो आएगा बस नो डाउट अबाउट इट इन hypovolemic shock there is once more very standard topic renal blood flow regulation renin angiotensin system right system and shock and types of shock hypovolemic shock cardiogenic shock everything come on so punch your answer doctor at least now చెప్పండి ఆన్సర్ ఏం చెప్పండి afferent arteriolar ఎందుకు GFR ఎప్పుడు పెరుగుతుంది చెప్పండి how will GFR increase more afferent blood flow
more GFR
vasodilation and different में constriction what will happen in hypovolemic shock
GFR opposite
luckily good that is the cause for whenever there is a hypovolemic shock the amount of the blood flow which is going to the glomerulus decreases because of the constriction and to overcome that you give dopamine low dose which is a vasodilator okay now what components are responsible for counter current mechanism in kidney मैंने क्या बोला इसके पहले ही बोला definitely everything on nephron physiology there is no question paper without that today only you go back to the 1200 pages notes and 1150 topics ने already हमने PDF दिया अगर आपको PDF नहीं मिले तो please call 9000868356 our helpline number and get 1150 high yield. आप पूरा पढ़ने की जरूरत नहीं है, 1150 में 500 पढ़ो बस. कैसे भी अभी आप मितना जी आप सबके लिए लिख रहे हैं, लाइक नन्नया तिक्कना एर्रना भागवतम. Now बोलो, what is your answer? Counter current means typically all electrolytes will move from or reabsorbed into surrounding interstitium. From interstitium they go into vasa recta. So what will happen? Thick ascending loop low.
Sodium up. Yes, it's impermeable to water.
Sodium outflow in thin ascending limb.
Not thick, that is false or except.
Except बोला ना, आप ये सही बोला, बिकॉज यहाँ सोडियम पोटेशियम 2 क्लोराइड रहता ना.
That all get exchanged in place of water.
And thin descending is
Thin on the this side.
Water outflow.
Out.
And flow of tubular fluid from
That is, sir, thin descending also.
ఏది
Thin ascending or ఏమి ఉండదు, sir. Thin descending.
thin descending.
Thin descending you said na, sir. Concentration is highest there because మొత్తం water reabsorb.
Correct.
Thick ascending is impermeable to water. All electrolytes, all the sodium, potassium, chloride, channel, that is getting reabsorbed.
Sodium potassium 2 chloride is being reabsorbed in the.
Basically, almost
మీరు ఏం చేయండి అంటే కొంచెం క్విక్గా స్కోర్ యాప్ में जाके नेफ्रॉन के बारे में जो भी 3-4 पैराग्राफ्स हैं, आई थिंक अबाउट 8 to 10 पैराग्राफ्स आर देयर इन द नोट्स आल्सो. वो इमीडिएटली रिवीजन करो. रोज रिवीजन करने वाला माल है ये. डाइल्यूटिंग सेगमेंट इज व्हाट, concentrating segment is what in the nephron. Distal convoluted tubule में क्या होता है, cortical collecting duct में what are the aquaporine channels रहता, epithelial sodium channel रहता. Epithelial sodium channel is under the influence of what, different types of cells. Intercalated cell क्या होता है collecting duct में. कृपया पढ़ो. అదే ఉందా ఆన్సర్? అంటే నేను చెప్పిందా నేను ఒరిజినల్గా వేసిందా? Then glucose is absorbed in intestine by 1 MCQ sure shot on secondary active transport, facilitated diffusion, primary active transport and simple diffusion. ये 4 are the keywords, doctor. 1 MCQ is so this is one among the 100 स्टैंडर्ड वाला माल है कल के नीट पीजी में. ये रॉन्ग करे तो भगवान भी क्षमा नहीं करेगा. जल्दी बोलो, जल्दी रॉन्ग करो. आपका मी पाटा प्राइमरी एक्टिव ट्रांसपोर्ट. दीक्षा जी आप क्या बोले थे? Facilitated diffusion. Emergency physician है ना. Insulin like growth factor is produced by IGF. Once more, hormones में growth hormone, steroids, pituitary hormones, thyroxine, ये सब सुपर डुपर स्टैंडर्ड टॉपिक्स है. एक गेस मारो बेटा, गेस मारो, रॉन्ग मारो, राइट मारो, गेस मारो, जल्दी बोलो. రాసుకోండి టాపిక్లు. పిట్యూటరీ హార్మోన్స్, గ్రోత్ హార్మోన్, థైరాక్సిన్.
HPO axis and HPO axis hypothalamus.
No, hypothalamus కాదు, పిట్యూటరీ, గ్రోత్ హార్మోన్, థైరాక్సిన్. పిట్యూటరీ హార్మోన్స్, గ్రోత్ హార్మోన్, థైరాక్సిన్, స్టీరాయిడ్స్. స్టీరాయిడ్స్ में గ్లూకోకార్టికాయిడ్స్, మినరలోకార్టికాయిడ్స్. కంపల్సరీ ఒక క్వశ్చన్ వస్తుంది. సెకండరీ మెసెంజర్స్ is another very very high, which uses cyclic AMP, which uses cyclic GMP, which uses inositol triphosphate. वो सब हमने दे दिया ऑलरेडी एंडोक्राइन रिव्यू में। हाँ? जरा एक बार एक मर्तबा रिवीजन करना, बहुत टाइम है आपके हाथ में। गेस मारो।
Pancreas.
हाँ?
Pancreas. Pancreas అనుకుంటున్నాను. Liver.
See, what is meant by Lackey-Leron dwarfism? Leron dwarfism and this. See, growth hormone ఉంది కదా, ఇది how does it act on the, it has got a intermediate, which is the insulin-like growth factor 1. IGF-1 is produced by liver. In few people, IGF-1 is not produced. Because of that, even though growth hormone is there, end organ may effector molecule is not there. And that is called Lackey-Leron's dwarfism. Endocrine lo చెప్పుకున్నాం. Then what is prosopagnosia?
Prosopagnosia is
Anjan marna.
identifying known phases.
Difficulty in identifying known phases. Anjan marna is called prosopagnosia.
అది రాసుకోవట్లేదు.
ఇది స్టాండర్డ్ రెడ్ లైట్ కాదు.
అదే అంటే రాసుకోవట్లేదు ఎందుకంటే తెలుసు కదా.
లేలే అక్కలే. ట్రాన్స్పోర్ట్ అక్రాస్ న్యూక్లియస్ ఈజ్ బై ఆల్ ఎక్సెప్ట్.
Importance.
వన్స్ మోర్ రెడ్ లైట్ క్వశ్చన్. మీరు అసలు చెప్పాలి, ఇది రెడ్ లైట్ క్వశ్చన్. ఐఎమ్ నాట్ గోయింగ్ టు అటెంప్ట్.
Sir, I know.
You know, doesn't matter. You know transport, you know across, you know nucleus. Only you don't know what is the answer.
I know its importance and exportance.
అన్నది రేయండిగా అట్లీస్ట్.
వదిలేస్తాను నేను.
ర్యాట్ ప్రోటీన్ అంటే ర్యాట్ ప్రోటీన్లు క్యాట్ ప్రోటీన్లు ఎడ చదువుకున్నావా? ఎప్పుడైనా అసలు విన్నట్టు గుర్తుందా? दिस इज फेवरेट क्वेश्चन डॉक्टर, ये रॉन्ग करे तो घंटी बजेगा. DMT1 ferroprotein regulator, but original iron uptake is by DMT1. మళ్ళా ఒకసారి చదవండి. ఐరన్ ట్రాన్స్పోర్ట్ इज ए हॉट टॉपिक में ऐड करो. सेरोटोनिन is also known as,
5-hydroxytryptamine.
इसको बोलते हैं बिस्किट वाला क्वेश्चन, कोई भी आंसर करेगा. थायरोसिनोसिस is due to deficiency of
Transamines.
last time also this question came one of the evenings. I told that amino acid के आत्मा citric acid cycle में जाएगा.
Fumarate acetoacetate.
మరి ఎట్లా फ्यूमराइल एसिटो एसिटेस. आप क्या कीजिए ना, एमाइनो एसिड मेटाबॉलिज्म में श्योर शॉर्ट क्वेश्चन आता है. क्या आता? टायरोसिनोसिस, फिनाइलकीटोन्यूरिया, alkaptonuria, maple syrup urine disease, maple syrup urine disease, and what are the different amino acids that enter into which part of the citric acid cycle? Different amino acids, when they are metabolized, which part of the citric acid cycle will their carbon skeleton center? Is a favorite topic of the examiner, Dr. Amino acid metabolism. Sure revision karna. Iga idi cheppakunte iga waste. Lashkari Khan. HGPRT. This is called biscuit question. Fish adore syndrome is due to monoxygenase.
2022 వచ్చింది.
వస్తుంది, అదే क्वेश्चन बैंक కదా, एग्जामिनर का एक ही क्वेश्चन बैंक है. घुमा के गैलेक्टोसीमिया स्टैंडर्ड टॉपिक लिख लो. गैलेक्टोसीमिया स्टैंडर्ड टॉपिक है. वंस मोर इसमें 2 टाइप्स रहता है, गैलेक्टोकिनेस एंड गॉल्ट galactose uridyl transferase, galt deficiency. 2 types होता है, classical galactosemia and other is the other one. Similarly, लिख लो fructose में hereditary fructosuria and essential, hereditary fructose intolerance and essential fructosuria. श्योर शॉर्ट एग्जामिनर पूछेगा कल के एग्जाम में, राइट? सो इसका आंसर क्या है? गैलेक्टोज 1-phosphate uridyl transferase, which is most abundant product of fatty acid synthesis. Very good. ఆల్రెడీ రాసుకున్నారా? ఆల్రెడీ రాశారా ఇది? అదే ఏదో ఒకటి వస్తుంది, ఎస్టైల్కోయే, మెల్నల్కోయే, కార్నిటైన్. హౌ మెనీ ఏటీపీస్ ఆర్ ప్రొడ్యూస్డ్? రాలేదు కదా. సో ఫ్యాటీ యాసిడ్ బయోసింథసిస్ అండ్ బీటా ఆక్సిడేషన్ ఆఫ్ ఫ్యాటీ యాసిడ్, ఈ రెండిట్లో ఏదో ఒకటి బుర్రుమని వచ్చేస్తుంది పరీక్షలో. సో ఇట్స్ వెరీ ఈజీ టు ప్రెడిక్ట్ వాట్ ఎగ్జామినర్ వాంట్, ప్రొవైడెడ్ యు ఆర్ రెడీ విత్ దట్. Honestly, last 4-5 days में every day you should be able to revise the entire 19 subjects. You are able to do entire 19 subjects revision in the last 4-5 days, you are the topper. That shows how much you are already prepared well. But at least now ek baar to karo. That's the reason I'm disappointed to know that you suddenly don't change the strategy. वो आके pediatrics पढ़ेंगे बोले तो don't go by her pediatrics. Who is she? I gave you 50. You finish 50. Today I'll give you 100. You finish 100 and be ready by tomorrow. You stick to that for the next 4 days. Seat नहीं आए तो मेरा जिम्मेदारी. DNA polymerase 1. Which one is correct? I already told you yesterday only. टाइप्स ऑफ पॉलीमरेजेस 3 पढ़ो बेटा बोल के मैंने बोला. Yesterday टॉपिक्स में है क्या? All 3 types of polymerase, what are the differences between them? पढ़ो अम्मा. So it is not required in bacteria. Prokaryotes में नहीं रहता, eukaryotes में रहता. Okay? This is a biscuit question. What will chaperones do?
Chaperones is the carrying, folding.
Protein folding. माफ कर दिया. देखो, chaperones, heat shock proteins, hit list of examiner. Chaperones, heat shock proteins. Already DNA polymerases types लिख लिया ना? Very good. Fishy odor occurs due to deficiency of what from the diet? Riboflavin deficiency. Once more, vitamin deficiency. One of the vitamins, vitamin एग्जाम 200 का नहीं, विटामिन 1 रहता है. अगर विटामिन को अगर आप नेल डाउन नहीं करे तो भगवान भी क्षमा नहीं करेगा. ठीक है? कितने पेजेस में दिया मैंने नोट्स को? पूरा 1200 पेजेस में 2 पेजेस विल बी विटामिन, मैक्स 20 पैराग्राफ्स, 100 पॉइंट्स इन द नोट्स आई गेव यू. उसमें से ही आएगा, कुछ भी बोलो आप. VMA is excreted in urine. This is called biscuit. Vinyl mandelic acid. Rule of 10. హైపర్ ఎపిసోడిక్ హైపర్ టెన్షన్. మరి ఎట్లనండి మీరు ఏడున్నారు? పాతాల లోకల్లో ఉన్నారు. యూ కంప్లీట్లీ డిసప్పాయింటెడ్ బై సేయింగ్ దట్ యూ డోంట్ నో దిస్. ఎనీవే, లిక్లో ఫియోక్రోమోసైటోమా. I told you na ma. COMT catechol-O-methyl transferase converts the norepinephrine into epinephrine, and difference between medullary and extramedullary pheo. Pado pheo. All the following are excreted in cystinuria except once more liklo. Cystinuria standard topic. Cola, cysteine, ornithine, lysine, arginine. Cysteine, arginine, ornithine, lysine. Coca-Cola is cystinuria. Right? Cystinuria, please review. Then fibrinopeptide A and B are acidic because of which amino acids in its structure? I already told you all amino acids. ग्लाइसिन का स्पेशलिटी क्या है? सबसे छोटा. जहां भी ग्लाइसिन होता है वहां प्रोटीन टर्निंग लेता. प्रोलीन का स्पेशलिटी क्या है? वो इमाइनो एसिड, नॉट एमाइनो एसिड, and it is involved in hydroxyproline, which is structural support. Histidine का स्पेशलिटी क्या है? इसका pK value is equal to the pH of plasma. So that is the reason the buffering capacity is all because of histidine. అట్లా ప్రధానికి ఒక స్పెషాలిటీ ఉంది. సో అట్లనే ఇట్ ఈస్ ది గ్లూటమేట్ అండ్ aspartate. But still you can leave this as a red light area question. This is not a regular fact base. పోనీ ఇప్పుడు ఇది చెప్పండి, ఇది తప్పు చెప్పారంటే నాకు నేను వెళ్ళిపోతా. హైడ్రాక్సీ ఇండోల్ ఎసిటిక్ యాసిడ్ हिया. बोल राधा बोल, संगम होगा या नहीं? जल्दी. गुड गर्ल. बत किचो मैं नहीं तो अभी चाकू पत्र देके जाना है. ये तो इसको बोलते हैं बिस्किट क्वेश्चन. दूध पीते बच्चे भी आंसर करेगा. This is another biscuit question. Warthin Finkeldy. Come on. Sure. Measles. Anyway, ask Randy. Measles is standard. Chicken pox is standard. One MCQ आएगा. Right? One CD marker आएगा ना? CD59 is the marker of?
PNH.
Beautiful. So అది కూడా రాయండి. CD markers ఒకటి నిన్న రాష్ట్రం. PNH is another thing. Which one is option in? C3B. చూసిన చదివితే పెట్టేస్తారు అసలు. You don't take time. If you are well prepared for examiner. लिख लो complement pathway. Compulsory एक क्वेश्चन आएगा. Hyper sensitivity. Compulsory एक क्वेश्चन आएगा. Hyper sensitivity types में. ऑटो इम्यून हिमोलाइटिक एनीमिया कंपल्सरी एक क्वेश्चन आएगा. ऑटो इम्यून हिमोलाइटिक एनीमिया कंपल्सरी. व्हाट इज द वार्म टाइप, कोल्ड टाइप? ठीक है. देन हेरिडिटरी स्फेरोसाइटोसिस कंपल्सरी एक क्वेश्चन आएगा. हेरिडिटरी स्फेरोसाइटोसिस. सिकल सेल एनीमिया कंपल्सरी एक क्वेश्चन आएगा. सिकल सेल एनीमिया నేను రాసినమా? వెరీ గుడ్. రైట్. సో हेरिडिटरी स्फेरोसाइटोसिस, ऑटो इम्यून हिमोलाइटिक एनीमिया ऑलरेडी टीटीपी HUS लिखा है. అంతే మరి ఎందుకుండదు? చదవాలి కాకుంటే. నేను చెప్పిన గ్లాన్స్మెన్, వాన్ విలిబ్రాండ్, बर्नर्ड सोलियर कंपल्सरी एक क्वेश्चन आएगा. GP1B, Bernard Solier. 2B, 3A is Glanzmann. VWF is Von Willebrand disease. लिख लेना Von Willebrand, Bernard Solier, Glanzmann. నేను చెప్పినా కదమ్మా, నేను థ్రాంబోలైటిక్స్ చదవాలి, యాంటీప్లేట్లెట్స్ చదవాలి, యాంటీ థ్రాంబోటిక్స్ చదవాలి, అందులో డైరెక్ట్ ఏంటి, ఇండైరెక్ట్ ఏంటి, ఓరల్ ఏంటి, సంగీతం సాధన చేసి రావాలి అమ్మాయి. So you have to finish the practice of what we decided yesterday in our board meeting. Otherwise we'll fire you as the CEO. Don't get carried away by unnecessary influences around. The same problem happens, when you go to big coaching centers, 400-500 people, everyone talk about their own style. अपना स्टाइल खो जाते हैं आप. मैं बोल रहा हूँ ना, क्या स्टाइल से आपको सीट आएगा, टाइम बहुत कम है. Cowden syndrome, P10. Once more, what did I tell you? Tumor suppressor genes, proto-oncogenes. एक लिस्ट दिया ना मैंने पैथोलॉजी में, उसमें P10 रहता, आप जाके देख लो. अब जब गैस्ट्रोएंट्रोलॉजी में पैथोलॉजी, जनरल पैथोलॉजी का मैंने नोट्स दिया ना, उसमें मैंने ये दे दिया, जरूर आएगा. क्रोमोसोम इन्वॉल्व इन मायोटोनिक डिस्ट्रोफी. Once more, myotonic dystrophy by itself is a very standard topic. There will be 7-8 points about it. They'll have difficulty to leave your shake hand, they'll have baldness, and they will be having testicular dysfunction, hypogonadism. Red light, but this is a standard thing. Andhra Medical College, Guntur Medical College, టింగు మని బట్టి కొట్టి రెడీగా ఉంటారు దూకడానికి. ఆన్సర్ 19. Trolley occurs how many hours of transfusion? लिख लो acute transfusion reactions. In that, hemolytic, non-hemolytic, febrile, afebrile. So how do you differentiate one from the other? So Trolley occurs within how many hours of transfusion? It's a very standard question. Guess मारने का स्कोप ही नहीं है इसमें. कुछ मारने के ट्राई करे तो मर गए. More than 6 hours. Kidney response to shock by, I told you, shock is the standard topic. By increasing afferent arterial resistance. This is the same question repeated. What is the clinical sign here? A biscuit question. Wilson's disease का ceruloplasmin. Epithelial tumor of the stomach कौन है? Gastric adenocarcinoma. This is stromal tumor, no? Just is stromal tumor. So adenocarcinoma is epithelial. Anyway, carcinoma stomach लिख लो. सर्जरी में आता, पैथोलॉजी में आता, GIT रिव्यू में आता, बहुत जगह दिए हैं इसको. कार्सिनोमा स्टमक लिख लिया ना. और फिर पेप्टिक अल्सर का बिलरॉट टाइप 1, बिलरॉट टाइप 2, डंपिंग सिंड्रोम कंपल्सरी प्रति परीक्षలు వస్తుంది ఇది. గ్యాస్ట్రోజెజినోస్టమీస్. So Billrod type 1, Billrod type 2, gastrojejunostomy, dumping syndromes, and peptic ulcer में differences between GU versus DU, gastric ulcer versus duodenal ulcer. And also please add, gist is a high yield topic. C-kit mutations will be there in this. Gist में. You remember? C-kit mutations. So, very good to see 44 online classmates. Actual preparation for entrance involves not more than 500 topics, from which these 100 MCQs, standard MCQs will come. 500 टॉपिक्स पढ़ने के लिए आपको लगेगा 500 into 3 minutes, 1500 minutes, which is 25 hours में around the world in 25 hours कर सकते, provided you need to stick your greediness of amassing the subject. You need to hold your anxiety that I need to read everything very cleanly, obsessively. No, not now. अभी नहीं. ये कब ने ना अप्रैल में लो ఉండాలి टेम्पटेशन. अभी क्या है ना, युग की समाप्त हो रहा है, युगांत में आ गए हम. These last 5 days are like MRI done, somebody told you have metastasis and you need to decide what to do with the leftover life. 10 Vidaniya. There is a nice movie called 10 Vidaniya. A guy knows that he got cancer, about to die. So he will prepare one wish list, bucket list. He will go dates with a Russian girl. He will do a lot of things, which he never could do. So like that, this last 4-5 days is like terminal illness of NEETPG. Ventilator ke upar hai hum. Now identify the X-linked disorder. Biscuit. H&L variety is seen in lymphocyte predominance. Already yesterday likha na. Hodgkin's, non-Hodgkin's lymphoma, Reed-Steinberg cells, etc. Stellate granuloma. Already I discussed this in pathology review. I don't know coaching is useful or useless. But just a few days back only we discussed no pathology. किया या नहीं किया? उसमें caseating granuloma, non-caseating granuloma, stellate ganglioma. ఇక చెప్పకుంటే నేను వేస్ట్. Cat scratch disease, beautiful. Then which option best explains flipping effect? Normally, who is more? Whenever LDH1 is more than LDH2, it's called flipping effect.
Normally 2 is more.
Reverse. So, this is one of the 50 red light questions. Nude mice is not resistant to xenograft because it does not have T cell.
T helper.
Anyway, transplant immunology. What is allograft, xenograft, autograft? Similarly, acute, hyperacute, and chronic rejection, graft rejection, and all the immunosuppressants which are used for during transplantation. Transplantation में immunosuppressants favorite topic. Then उसमें आप mycophenolate, mofetil, sirolimus, tacrolimus, all those things पढ़ना है, बराबर? और post-transplant infections, they are divided into early infections and late infections. ये भी मैंने पूरा नोट्स में दे दिया, जरा आप ध्यान से पढ़ो. एक क्वेश्चन ट्रांसप्लांट में आएगा. अगर आप सोचे कि ये मेरे बस में नहीं है ट्रांसप्लांट वाला मामला, if you feel transplant I can't revise, means I will try to prepare a quick review of all this. रोज मैं भी आपके लिए करूंगा, डेफिनेटली वन क्वेश्चन आएगा. Transplant immunology, transplant pharmacology, transplant pathology. Right. Identify the condition represented below. So the monotonous appearance is seminoma. Testicular tumor is the favorite topic. लिख लो. Already लिखा? लिखे जो खत तुझे जल्दी. हाँ. Testicular tumor. What are seminomas, non-seminomatous tumors? What are the tumor markers? What is the histology? Anaplasia, metaplasia, dysplasia, hyperplasia, aplasia. Definite question. So a biscuit question. De-differentiation is the feature of anaplasia, which is malignant. Which level of prolactin calls it prolactinoma? Red light area question. हमको prolactinoma मालूम है. That is a temptation. मुझे मालूम है. Prolactin मुझे मालूम है. Dopamine inhibits prolactin. वो भी मालूम है. Prolactinoma भी मालूम है. Micro prolactinoma मालूम है. Macro prolactinoma मालूम है. मगर prolactin levels मालूम नहीं. Because this is red light area question. Don't attempt to jump and put some last moment disgusting answer. नहीं चलेगा. 1/4 mark कट जाएगा. Why Lord Balaji is called Venkateshwara Swami? वे बोले तो हेर कट कटेश्वरुడు. People go and अपना मुंडन करेगा. तो इसलिए वेंकटेश्वर को वेम को कट करने वाला वेंकटेश्वर है. So that's the point. Now, laxative abuse cause which renal stone?
Calcium.
చెప్పండి. Ammonium urate. Renal stone is a very standard topic. One question invariably comes. What are struvite stones? What are radiolucent? What are radio opaque? Standard topic. Now, what is this condition that you are seeing? ये तो बिस्किट क्वेश्चन है. फिर भी आप लिख लो. न्यूमोनिया, types of pneumonia, interstitial pneumonia, lobar pneumonia, then bronchopneumonia, then alcoholics में bulging fissure sign. Where do we see all those things? Under pneumonia. Pneumonia ready, कड़क कड़क रह के जाना एग्जाम को. इसमें क्या दिख रहा है आपको? इसमें दिख रहा है मिलियरी टीबी. दिस इज बिस्किट क्वेश्चन. ये प्रिपेयर होने से कुछ भी नहीं होता. वो देखते ही बोल सकते. दूध पीते बच्चा भी बोल सकते. Dactylitis is seen in చూపించినా కూడా కదా, ఈ బొమ్మ చూపించినా కదా. సికల్ సెల్ ఎనీమియా ఈజ్ స్టాండర్డ్ టాపిక్ నా. Then production of Mullerian inhibiting factor.
Chromosome 16. 22 or 16.
అమ్మా, Mullerian inhibiting factor ఎవరు?
Mullerian inhibiting factor males లో ప్రొడ్యూస్ అవుతుంది. Why don't?
But it is 22. You said 22. I don't know this. Is it?
But it is produced in males.
That's okay. But male 22 only producer. Shouldn't it correct కదా? Mullerian inhibiting factor chromosome 22. నేను ఇంకా వై అనుకున్నానే. అయ్యో. Online students punch it. अम्मा वो मुलेरिन इनहिबिटिंग फैक्टर नहीं. MIF बोले तो मैक्रोफेज माइग्रेशन इनहिबिटिंग फैक्टर. Macrophage migration inhibiting factor, which is by the chromosome 22 Q1. Q1, which is involved in your digeorge also, no? Digeorge.
Digeorge 22 Q11.
अरे digeorge is chromosome 22q,
Deletions.
Q11 deletion, which is involved with macrophage migration inhibiting factor. But anyway, you can throw this in red light area. Very high temptation for answering Y chromosome. All right, doctor? Now, Burkholderia cepacia is resistant to. ముందు అదేదో తెలియదు మనకి తెలియని వదిలేయండి సిఫోటిటాన్ shingles is caused by biscuit question varicella zoster urea breath test biscuit question ఏంటి మరి ఇంకేమన్నా ఆలోచనలు ఉన్నాయా హైపర్ అక్యూట్ గ్రాఫ్ట్ రిజెక్షన్ ఐ టోల్డ్ నా హై yield టాపిక్ when do you call అంతే Australian antigen for hepatitis B expected na Australian antigen సరే దేనంటారు సిడ్నీ ఎక్కడ ఉంటుంది సిడ్నీ అంటే ఎస్ ఫర్ హెచ్బిఎస్ఏజీ ఓయ్ రామ బట్ ఎనీవే అది నేను చెప్పలేదు నిన్ను రివైజ్ చేయమని ఇవాళ తప్పు చేయొద్దు ప్లీజ్ డోంట్ లిసన్ టు ఎనీబడి ఎల్స్ ఓన్లీ లిసన్ టు మీ విచ్ ఫంగస్ ఈస్ మోస్ట్ కామన్లీ ఆర్బిటాల్ సెల్యులైటిస్ డయాబెటిక్ కిటోసిస్ మ్యూకర్ ఆస్పర్జిల్లస్ అంటే ఇది ఆర్బిటో రైనో సెరిబ్రల్ అనుకోండి ఓకే బట్ ఎనీవే డీకే ఇస్ ఎ స్టాండర్డ్ టాపిక్ Sabin Feldman dye test. Standard question. Good. Acute hemorrhagic conjunctivitis is which enterovirus type? Standard question. और एक बार मैंने बोला ना वर्नल केरेटो कंजंक्टिवाइटिस herpes keratitis is a standard topic and all types of conjunctivitis पूछेगा examiner 70 echinococcus granulosus which of the following dog. Once more, hydatid cyst is a standard topic. आपके पास 5-6 points रहना expecting from hydatid cyst. Examiner पूछते ही jump and answer. Anaerobe causing multiple abscesses with discharging sinuses with sulfur granules. అంతే ఆల్రెడీ నేను రాసుకున్నాను కదా actinomyces, nocardia, madura mycosis. Whole blood test is used as a sample for which test? हम इस देश के वासी हैं IGRA. But you can take this as a red light question. Too much है tempting है ये बाहर रावल है you should get that.
But sir, like Diksha says, TB lo ochindanda sir.
TB లో whole blood యూజ్ చేస్తారు ఇది జెన్ ఎక్స్పర్ట్
Latent TB is being diagnosed by IGRA and sir. దాంట్లో whole blood is so TB she has a point.
Still acute bacterial prostatitis हमको prostatitis मालूम है बैक्टीरिया मालूम है which बैक्टीरिया prostatitis मालूम नहीं है ఇంకా కొంచెం బెటర్ గెస్ కొట్టి ఉండాలేమో Where is prostate? Genital system. Where is gut? If vaginitis can come with E. coli coming from slipping from the anus into vagina, why can't in men prostate? అయ్యో ఇదేంటి ప్యూర్లీ ఇది కూడా ఒక రకంగా రెడ్ లైట్ ఏరియా. If you make wild guess, unless you make super duper E. coli guess. Huh? Histamine and causes rhomboid fish poisoning. Pseudomonas aeruginosa. But Pseudomonas is a standard topic. Who is the father of microbiology? Otherwise, we'll give you MD microbiology seat. Anton von Leeuwenhoek, who hooked on microscope. ఇదంతా జీకే जनरल नॉलेज. नॉलेज भी नहीं है, जनरल भी नहीं है. Cutaneous larva migrants and visceral larva migrants, standard topic. And visceral larva migrants. ఇది చెప్పండి తొందరగా. హుక్ వామ్ లా అమ్మా, హుక్ వామ్, రౌండ్ వామ్, పిన్ వామ్, all worms. I taught 2 times. फिर भी अगर आप, if you can't open mouth and say ankylostoma, then मैं क्या करता हूँ? आप पढ़ोगे ना, पूरा worms लिख लो. 5 worms. क्या क्या लिखा आपने? पिन, हुक, round, thread, ఇంకా టేప్, ఇంకా ఇవి తాగితే మేము సంతోషిస్తాం. అట్లనే ప్రాజిక్వెంటలు, పైరాంటల్ పామోయేట్, ఆల్బెండజోల్, నిఫర్టిమాక్స్, దేంట్లో ఇస్తావు? ఆల్ ది एंटी-हेलमिंथिक्स एंड हेलमिन्स पूरा 1 पेज में हो जाता रिविजन, मगर वो 1 पेज का टाइम देना है लास्ट 1 वीक में. दैट इज इंपॉर्टेंट डॉक्टर. वेरी गुड गौरी. टॉक्सोकैरा विसरल एंकाइलोस्टोमा क्यूटेनियस बोला हमारा गौरी जी ने. बढ़िया. After kidney transplant, which organism most likely to happen? I told you, post-transplant infections. Favorite topic. Bol. CMV. Microbial cause of catheter infection, young female. We'll check. We don't have answer. Identify the organism in the blood smear. We can't see anything. Malaria. Falciparum malaria. Banana, the gametocyte. దీని సెల్ లోపల ఉంది కదా, ఇంట్రా షైజాంట్. एकोली रिंग फॉर्म्स अंటారు కదా. हमने मलेरिया पढ़ना माइक्रो सब में आता ना, स्टैंडर्ड टॉपिक है. which is endogenous pyrogen. Very good. E2, that temperature set point को बढ़ाएगा, interleukin and prostaglandin जाके. That's the reason we get fever and shivering. Okay. Bartter syndrome is చెప్పాలి మీరు. Defect in DCT ना. Thiazide is gentleman. Barter is ascending limb of loop of Henle, like furosemide.
Barter, Pina, Gentleman,
DCT, like thiazides. This is like furosemide, loop diuretics na.
yes, sir.
అబ్బా ఎట్లా
Nephrology of చేస్తే వస్తుంది సార్.
ఏ చదవాలే నువ్వు చదవకుంటే కుదరదు. You are my betting horse, jockey, betting jockey. Barter, but the jockey is walking with a limp. Little
Gentleman.
gentleman,
సార్ ఇంకోటి P
Gordon. ఈ నాలుగు బుర్రు బుర్రు చదవాలి.
సార్ PCBలో వచ్చేది. PCBలో వచ్చేది.
Fanconi. Fanconi syndrome. आज रात ही जाके 12 बजे के पहले पढ़ लो. Not seen in ABPA, allergic bronchopulmonary aspergillosis. I told you, there are criteria for that. Central bronchiectasis will be there. Recurrent fleeting pneumonia will be there. But that is not included in allergic ABPA diagnosis में नहीं है. IgE occurrence in patient with old cavity lesions, pleural effusion. They are all the part. ABPA అని ఒకటి ఉంటుందమ్మా, allergic bronchopulmonary aspergillosis. इसमें central bronchiectasis रहता, fleeting pulmonary infiltrates रहता, hyper IgE रहता. అది aspergilloma ఓల్డ్ క్యావిటీస్లో. మీరు ఒకసారి చదవండి క్రైటీరియా ఆఫ్ ఏబిపిఏ, గట్టి చదవాలి. ఇప్పుడు ఇది చెప్పండి. ఈసీజీ అంతసేపు అటెండ్ అయ్యారు కదా, చెప్పండి. సూడో పీ పల్మోనల్. పీ పల్మోనల్ అంటే ఫస్ట్ ఏంటి? ప్రామినెంట్ పీ వేవ్. ఏ లీడ్లో పీ వేవ్ విల్ బి మోనోఫేజిక్, విచ్ లీడ్ పీ వేవ్ ఈజ్ బైఫేజిక్. గుర్తొచ్చిందా? రెండు ఉంటాయి కదా, పీ మైట్రేల్ ఒకటి, పీ పల్మోనేల్ ఒకటి. V1 is రెండు లీడ్స్ ఉంటాయి, ఒకటేమో లీడ్ టు, అదర్ ఈస్ V1. They are the places where you look for the P wave. So in the lead V1 is a right-sided lead. That's the reason initial deflection is it is moving typically in the P wave. Right and left activities are superimposed on each other, leading to one single P wave. The moment left atrial enlargement is there, then that separates from right atrium. That leads to mitral. Prominent is when right atrial activity is high, like in pulmonary hypertension, which is called P pulmonale. So, hypokalemia is associated with pseudo P pulmonale, even though pulmonary hypertension is not there. But anyway, this is a standard question. What? ECG. Automatic implantable cardio defibrillator implantation is done in which condition?
Automatic implantable.
Very good. All of them. They are all the indications. What is the treatment of intractable Sydenham chorea? Good. Valproate. अच्छा क्या सवाल है? न्यूरोफाइब्रोसिस टाइप 1 का क्राइटेरिया क्या है? एक बार लिख लो. NF1, NF2. Neurofibromatosis type 1, 2 is a standard topic. So इसमें brain tumor, pseudoarthrosis, cephalite spots, they are all part of. एक बार criteria देखना आप. Bilateral acoustic neuromas are a feature of NF2. Most common site of chronic gastric ulcer. I told you, gastric ulcer is the standard topic. Pyloric antrum. Approximate interval between HIV and AIDS is 10 साल लगेगा. Heller's myotomy is done for अय्यो ecalesia cardia में that is a spasmodic lower esophageal sphincter not ready to relax, so you make an incision and release it. Heller myotomy అమ్మా. అచ్చా మీరు విల్ల అటెండ్ కాలే మరి ఎట్లా అటెండ్ అవ్వాల్సిన టైంలో అటెండ్ మీరంతా ఇది డబ్బులు కడతారు, ఫీజు కడతారు ఉత్తగా. ఐఎమ్ లైక్ వెంకటేశ్వర స్వామి రిసీవింగ్ ఫండ్స్. యూ హెవ్ టు మేక్ ఫుల్ ఎక్స్‌ప్లాయిటేషన్ ఆఫ్ మీ బై కమింగ్. ఎనీవే ఇప్పుడు చదవండి, ఇప్పుడు ఏం మునిగిపోలే. దునియా కుచ్ భీ నహీ హువా. ఖాళీ ఎక్లేసియా కార్డియా పికప్ చేసి చదువప్ప. ఎక్లేసియా కార్డియా, డిఫ్యూజ్ ఈసోఫేజియల్ స్పాజమ్, डिफ्यूज इसोफेजियल स्पैज्म. एग्जामिनर उसमें है, जंकर डायवर्टिकुलम भी है. नेक्स्ट जंकर डायवर्टिकुलम के ऊपर पूछेगा, तो इसलिए जंकर डायवर्टिकुलम ऑल्सो लिख लो और पढ़ लो. कितना रहता? 4-5 पॉइंट्स रहता मैक्सिमम. Then myocardial stunning pattern not matching the ECG is called Takotsubo-cardiomyopathy. Cardiomyopathy is a standard topic. Dilated cardiomyopathy, hypertensive cardiomyopathy and restrictive cardiomyopathy. Usme Takotsubo-cardiomyopathy, we discussed this in cardiology. But anyway, pick it up and then do revision at least now, because one more question will come. Brugada syndrome also. Brugada syndrome, directly go to the score app and try to do the revision. Alternative drug for cardiac arrest in place of epinephrine. High dose vasopressin can be given. Once more, ACLS, BCLS, basic life support, advanced cardiac life support. CPR, how much depth will you do? If it is an infant, how will you do CPR? If it is an adult, how will you do CPR? ACLS, BCLS, what are the drugs that are being given? Sure shot, one question will come. Patient presenting with cutaneous vasculitis, glomerulonephritis, peripheral neuropathy, what is your diagnosis? Beautiful. लिख लो vasculitis compulsory. Without that there is no question paper है तो भाई मुरली नहीं. और एक क्वेश्चन भी आया, 2 क्वेश्चन आ गया. क्रायोग्लोबुलिnemia. Good. Hypokalemic metabolic alkalosis with hypertension. Huh? దేంట్లో చెప్పండి. మీరు have you not attended Little Barter Gentleman Garden? Then why you are behaving like morons?
Because I didn't revise it again. That's my mistake.
Okay. See, okay, I'll give you some clues. Come back. Without aldosterone only, epithelial sodium channels are being constitutively opened up because of the gain of the function mutation. Which syndrome में? हाँ? ये A syndrome में बोलो. अम्मा, Barter is like what? Giving loop diuretics. Gentleman is like distal convoluted tubule के ऊपर inhibition like thiazide. Renal tubular acidosis तो नहीं होगा. Little में क्या है? Even though aldosterone not there, because of the gain of function mutation, epithelial sodium channel, which normally is activated and opened by aldosterone, even without aldosterone only, will open and cause the sodium retention and loss of potassium and H plus ion. Because of the loss of the H plus ion, there is a metabolic alkalosis. Because of the loss of K plus, there is a hypokalemia. Because of the sodium retention, there is a hypertension. Normally, when aldosterone is high, all these things happen. But in little, even though there is no aldosterone, because of the gain of the function mutation, there is a constitutive, continuous opening of the epithelial sodium channel. जरूर आएगा कल के नीट पीजी में. एक लिटिल, एक जेंटलमैन, एक वाटर, एक गोल्डन, एक कॉन्स. लिखा कॉन्स भी लिखना. कॉन्स बोले तो एड्रिनल एडिनोमा लीडिंग टू प्राइमरी हाइपरएल्डोस्टेरोनिज्म. SIADH लिख लो, आज ही पढ़ लो. పాపాల మూట పెరుగుతున్నది. कितने हो गया? नंबर डाल रहे.
More than 50 actors. Clefts are arch pouches.
हाँ? हम एक बार भजन करते हुए रिवीजन करेंगे टॉपिक लिस्ट को, तब काउंट करेंगे. टेंशन नहीं है. ऑलरेडी हमने 100 क्वेश्चंस किया 2022 पेपर में. 50 टॉपिक्स निकला. अभी 100 खत्म करके देखेंगे क्या क्या है. टेंशन और ज्यादा बढ़ रहे तो मैं बंद करता हूं, नहीं तो चलो पाप का संख्या बढ़ाएंगे. कॉजेस ऑफ हाइपोकैलेमिक ये हो गया. गोल्ड क्राइटेरिया फॉर वेरी सीवियर COPD, प्योरली रेड लाइट एरिया क्वेश्चन. टच भी मत करो. MD पल्मोनोलॉजी खत्म करने के बाद आंसर करने वाला क्वेश्चन है ये. When FEV1 by FVC is less than 17, FEV1 is less than 30. ABPI increases artificially in, what is ABPI? Ankle brachial pulse index, which is used in peripheral vascular disease, to know how good is it. So whenever atherosclerosis with calcified artery which lost its compliance, ABPI typically increases. Minimal dysfunction syndrome is seen in this is also pure guess. Mental retardation is in a standard topic, but still this is too much a guess. Dyslexia.
Okay, the normal, but just that B and D without.
Correct. So what is the site of action of amphotericin B? मैं कल पूछा. Echinocandins, grief so fulvin. Amphotericin B. Huh? Nystatin, ketoconazole, fluconazole, like azoles, पूरा 6-7 क्लासेस है एंटी फंगल्स में. वो पढ़ के नहीं गए तो खत्म. यू आर ब्लीडिंग वन क्वेश्चन. It acts on cell wall. Which antiretroviral also has anti-hepatitis action? एंटीरिट्रोवल पढ़ने के लिए बोला. और हेपेटाइटिस HBV HCV में व्हाट आर द ड्रग्स? रिबाविरिन कब देते, पेगाइलेटेड इंटरफेरॉन कब देते, वो सब पढ़ना है. Emtricitabine has also anti-hepatitis action. Clear? Now, what is the drug of choice for resistant rheumatic chorea? I mean, same paper में, all recall based ना. At pK is equal to pH, what will happen? Fundamental organic chemistry, inorganic chemistry.
Concentration of drug is 50%, 50% non.
అదేనా ఆన్సర్? మంచిగా పెట్టు. కరెక్ట్, ఇది బిస్కెట్ క్వశ్చన్. రెడ్ లైట్ కాదు, బిస్కెట్ క్వశ్చన్. ఫిజియలాజికల్ డోస్ ఆఫ్ హైడ్రోకార్టిసాన్. దిస్ ఇస్ రెడ్ లైట్ క్వశ్చన్. 10 mg per kg per day. हाइड्रोकॉर्टिसोन बोले तो कॉमन, वेरी कॉमन फेमस ब्रांड ना एफ कॉर्लिन. हाइड्रोकॉर्टिसोन, व्हाट इज द स्पेशलिटी? इट इज द fastest acting. Dexamethasone is most powerful. So once more, all steroids.
That's why hydrocodone is given anaphylaxis.
Anaphylaxis and all that. Dexamethasone, methylprednisolone, prednisolone, and hydrocortisone, what is their relative strength compared to one another? What are their dosages? पढ़ना है. Because steroids, RMP సీను గాడికి కూడా తెలుసు కదా స్టిరాయిడ్ కొట్టుడు. మనకు తెలియకుంటే ఎట్లా ఊకోం. What is the mechanism of colchicine in acute gout? Gout drugs already standard topic ना, लिखे ना, कल के लिस्ट में है ना. చెప్పండి చెప్పండి. రాయలే గౌట్, అయ్యో సరే. గౌట్ మందులు, గౌట్ మెడిసిన్స్. యూ హ్యావ్ టు బి 100% sure, doctor. So good to see 45 online classmates. 2015, 16, 17, 18, 19, 5 पेपर्स में 5 into 300 1500 MCQs है. Even 20 also 1800 MCQs plus 21, 22 में 200, 200, 400, 2200 क्वेश्चंस है भाई. मैं ये 2200 बात करते करते एक 500 टॉपिक्स फाइनलाइज करता हूं. आप फिर घर जाके जो भी नोट्स आप पढ़ रहे हो, आई एम नॉट आस्किंग दिस नोट्स इज बेटर देन दैट नोट्स, मगर उस नोट्स में जाके ये पर्टिकुलर टॉपिक को 4-5 मिनट में खत्म करो. आप ये 500 टॉपिक्स को खेलते खेलते खत्म करे तो ऑटोमेटिकली यू विल गेट सी. दिस इज द बेस्ट अप्रोच इन द लास्ट 5-6 days. So doctors, colchicine is an inhibitor. ल्यूकोसाइट लिम्फोसाइट को माइग्रेट होना चाहिए ना, कहां को? इन्फ्लेमेटरी साइट ऑफ इन्फ्लेमेशन को जाते हैं. दैट इज स्टॉप्ड बाय inhibiting the microtubules. That's how colchicine is anti-inflammatory. Basiliximab, मैंने बोला ना एक मोनोक्लोनल एंटीबॉडी का लिस्ट दिया ना, उसमें से आएगा बोल के बोला ना, अभी बोलो. IL-2 receptor antagonist. And also all this nibble, imatinib, abs and nibs. Pyrenzapine is used in. Come on. Why? What stimulates peptic ulcer? Acid production by acetylcholine. So what is pyrenzapine? M3, muscarinic receptor antagonist. Which antipsychotic has increased prolactin secretion?
Option D is such as
Risperidone. लिख लो. Typical and atypical antipsychotics. Typical and atypical antipsychotics. All classes of antidepressants. Without that, there is no question paper, Amma. You don't want to read means forget about 2 marks. Right? Forget about 2 marks. So also to our online students, I want to tell you, if you feel any of these topics you can't quickly do revision, let me know. Mention it in the WhatsApp group. I will create 4 minutes, 5-minute videos for you and then post it on the YouTube for your last moment revision. I want to do whatever help I can do for you, like your junior, right? To help you. So, but you asked me, if you can read yourself, always that is the best thing. If somebody can actually quickly prepare points and then revise for you, that is another way of help. All right. So please be open to ask me in the WhatsApp study group. Which is a glucocorticoid synthesis inhibitor, which is also used in metirapone, prasugrel. ఆన్సర్ ఏంటి? ప్రసోగ్రల్ ఫేమస్ కదా, ఏది ఇది ఇంతకుముందు స్టాండర్డ్ అంటారా? వెరీ స్టాండర్డ్. మెటిరాపోన్ తెలియకుంటే ఎట్లా అండి? మెటిరాపోన్ ఈజ్ వన్ ఆఫ్ ద మెటిరాపోన్ ఈజ్ ఎ వే బై విచ్ యూ కెన్ ఈవెన్ టెస్ట్ సప్రెస్ స్టీరాయిడ్ ప్రొడక్షన్, ఎక్సెస్ స్టీరాయిడ్ ప్రొడక్షన్. చెప్పండి. ప్రసూగ్రల్, ప్రసూగ్రల్, టిక్లోపిడిన్. ముందు అసలు ఏ క్లాస్ డ్రగ్ అది? యాంటీప్లేట్లెట్, రైట్? ఇట్ ఈస్ ఎ ప్రోడ్రగ్. QT elongation is seen with which drug? అని చెప్పినా రాసుకున్నారా? లాంగ్ QT అని లిస్ట్ తెలవాలి కదా. క్వినిడిన్, క్వినిడిన్. సకుబిత్రిల్, సకుబై, sacubitril. Already we discussed this so many times. Is neutral endopeptidase inhibitor. See, मैंने antihypertensives को cardiovascular system में discuss किया ना बेटा. Nerlipsin, sacubitril, antihypertensives. Tiazine therapy is contraindicated in diabetes. Why? Come on, doctor. Is contraindicated in diabetes. Hypolipidemic therapy, standard topic. Hypolipidemic drugs is standard topic. చెప్పండి. Because it lead to అంతే కదా, one of the side effects. Endothelin acts on which receptor?
CAMP.
It's a vasodilator.
Calcium.
How nitrates and everything act? Sildenafil acts.
CAMP.
Energyna. Which is centrally acting alpha-2 agonist, mother relaxing, which is used whenever patient has spasms. చెప్పిన నేను ఇది యాంటీస్పాస్మోడిక్స్ మే. న్యూరాలజీ ఇలా ఫార్మకాలజీ డిస్కస్ చేస్తూ చెప్పిన, ఎక్కడ చెప్పినా కూడా నాకు గుర్తున్నది టిజానిడిన్, సెంట్రలీ యాక్టింగ్. ఎబిక్సబాన్ నేను చెప్పినా కదా, యాంటీకోయాగులెంట్ స్టాండర్డ్. వెరీ గుడ్. డైరెక్ట్ XAX. Anaerobes are resistant intrinsically against. అబ్బా ఇది నేను చెప్పినా కూడా మీకు Abba, we discussed this. Classical question in చెప్పిన మీకు.
Anaerobes are resistant.
They are intrinsically resistant against. సరే ఒక గెస్ కొట్టు, టెన్షన్ పడకు.
Amino glycosid.
Yes. అమ్మ బతికించిన తల్లి. Which is not bacteriostatic. That means bactericidal.
Linezolid and vancomycin.
ఇగోండి
Vancomycin, sir. Bactericidal. Vancomycin is
సెల్ వాల్ గనక బ్రేక్ చేస్తే అదేంటి, సైడలా స్టాటికా?
సెల్ వాల్ బ్రేక్ చేస్తే సైడ్.
ఇందులో ఏది సెల్ వాల్ బ్రేక్ చేస్తుంది, ఏది ప్రోటీన్ సింథసిస్ ఆపుతుంది?
ప్రోటీన్ సింథసిస్ ఆపేది టెట్రాసైక్లిన్, క్లిండమైసిన్.
ఆ,
సెఫలోస్పోరిన్స్ సైడ్ సెల్ వాల్.
చదవట ఆన్సర్ ఏంటి?
బి అండ్ డి.
వాట్ ఆర్ యు టాకింగ్? అలా అలా
సర్ బ్యాక్టీరియా అంటే vancomycin is bactericidal against
cephalosporin.
Vancomycin changes into DLR.
Cephalosporins are beta-lactam drugs.
Correct.
Bactericidal, sir.
Both of them. B and D.
B and D.
మరి డి ఎందుకు అంటలేవు నువ్వు, బి ఎందుకు అంటున్నావు?
Actually, sir, B vancomycin.
Anyway.
Clostridium difficile bacteriostatics.
Melanosis coli is caused by laxatives, antiemetics. Everybody leave these two topics, but the examiner will ask antiemetics and
In the antibiotics,
senna, which is the choice antibiotic for a bedridden patient with catheter-related UTI and pneumonia. I already gave this.
UTI.
Beta-lactam antibiotics with the beta-lactamase activity.
Ampicillin.
Mycoplasma is resistant to ఇది చెప్పకుండా వేస్ట్.
Amino glycosid cell wall layer. सेल वॉल layer तो cephalosporins काम करता.
మరి
सेफ्ट्रियाक्सोन भी काम करता. Resistant to booster, sir.
సబ్ట్రాక్సోన్, ఇవన్నీ ప్రోటీన్ సింథసిస్ కదమ్మా. సబ్ట్రాక్సోన్
అమైనో గ్లైకోసైడ్స్ మంచి పని చేస్తుంది. సెఫలోస్పోరిన్
ఆఫ్ కోర్స్ సెఫలోస్పోరిన్ కూడా ఇచ్చిండ, ఇది రాంగ్. బి
ఉంది సార్.
సెఫలోస్పోరిన్.
ఉంది సార్.
Subtraction is what? Is it not cephalosporin? What are you talking?
Sir, cephalosporin 5th generation is అంటే cephalosporin 5th generation ceftaroline ఉంది కదా sir, it works against mycoplasma and
Cephalosporin no?
cephalosporin 5th generation.
Fifth generation is still active on mycoplasma, na?
Mycoplasma, chlamydia, MRSA.
Very good.
Male, sir, male.
Huh?
Male.
Male. Okay. So subtraction is wrong.
Ceftriaxone is wrong.
Tadalafil should not be given with. Come on, quickly. हम डिस्कस भी किया ये. हाँ? Constrictor. Amma, tadalafil is what? Sildenafil. Sildenafil is acting on nitrates. Vasodilator. Already if the patient is taking anti-anginal drug which is a vasodilator, what will happen? He'll go into shock. So that's the reason before you give, we should check that you don't give. Patient is not on vasodilator. मैंने बोला या नहीं बोला?
Patient shouldn't be on nitrates and nitrogen.
क्या करेंगे भाई? मुझे डिप्रेशन आ रहा है. Estimate volume of ringer lactate in first 8 hours. ये तो चिल्लर चित का क्वेश्चन है. But one question on burns. Burns. Burns के बिना no paper. Posthumous child is child delivered after death of biological father. McNaughton's rules come under biscuit question. 84. Bluish coloration of gastric mucosa, one trace element toxicity. Metal, आप ही बोला ना, metal, bolo, emitol sodium, but this is not trace element, of course. Huh? Emitol nitrate. Muscle pain, nephropathy is caused by which metal? One metal toxicity बोल के लिखिए ना, पढ़ना चाहिए ना आप, नहीं पढ़ा. आर्सेनिक, मैंने कल भी बोला आर्सेनिक के ऊपर जरूर आएगा. Which is the first organ to putrefy? Putrefaction is the hot topic. Brain, दिमाग. Locard is famous for theory of exchange. Locard's exchange principle name itself is. What is base ossifid fuses with basis phenol? This is called red light area. Dur raho. And one advantage, if you identify now, which questions to not attempt, आपका बहुत मन की शांति मिलता, क्योंकि unnecessarily you will be doing like this, you will be putting your head under the table and then checking it, and all office thought tonus you will go into. Don't do such guesses. What is the smell of mummified body? Yeah. Stink is only for human body, not for dead body. But this is also purely red light. You know mummification, you know adopicine, you know saponification, but कहीं भी आप नहीं पढ़ते हैं कि वो odorless बोल के गया. You want to be a dead hero or a live coward? Live coward is much better in NEETPG. Patient presented with proximal tubular proteinuria. Which metal? Minamata disease.
Mercury.
Sorry, cadmium. Okay.
Cadbury is causing problem.
Constitutional article is not related to children. आपको हिम्मत है तो पढ़ो ऑल आईपीसी सेक्शन, नहीं तो भूल जाओ, अगले जन्म में पढ़ेंगे. फैक्ट्री एक्ट रास्कोंडी, फैक्ट्री एक्ट, ईएसआई, ये दोनों स्टैंडर्ड टॉपिक्स. फैक्ट्री एक्ट एंड ईएसआई. Child less than 14 carrying serious work. Incidence of disease is 4 per 1,000 with duration of 2 years. Calculate prevalence.
Prevalence incidence.
4 to the 8. Duration into incidence will give you prevalence. Incidence prevalence. Indicators of health बोलता बेटे. लिख लो. Secondary attack rate, case fatality rate, then incidence, prevalence, positive predictive value, negative predictive value, sensitivity, specificity. ये चीजें पढ़ना है बेटा. ये शूर आते हैं, उसमें डाउट ही नहीं. Incidence, secondary attack rate, case fatality rate. Secondary attack rate calculate करते वक्त will you consider primary case? No, we don't consider in both numerator and denominator. We don't consider. What is the relation? What is the formula between positive predictive value and specificity? If PPV value given, how do you calculate specificity? Specificity given, how do you calculate PPV? First of all, how do you calculate specificity? Sensitivity. ये सब चीजें हमने डिस्कस करके ऑलरेडी रखे हैं फॉर्मूलास. जरा एक मर्तबा. साइटोटॉक्सिक एंड एक्सपायर्ड ड्रग डिस्पोजल. मैंने बोला ना, ब्रोकन वायल्स क्या बैग में जाता, वो बैग को क्या करोगे आप? डंप करोगे, ऑटोक्लेव करोगे, लैंडफिल करोगे, बर्निंग करोगे. बैग से नहीं खत्म होता हमारा रिश्ता वेस्ट डिस्पोजल को. उसको बैग को ले जाके क्या करोगे? कम ऑन. लैंडफिल. For NRR to be 1, what is the CPR? Couple protection rate. Standard question. It should be 60%. और एक बार लिख लो, NRR, GFR, gross fertility rate, net reproductive rate, total fertility rate, all rates look same. And CPR, Pearl Index, ये पूरा बैठा हुआ है एग्जामिनर के क्वेश्चन बैंक में. समझ में है ना? So all these things you need to master, doctor.
So maternal mortality का infant mortality को transfer. Mortality rates.
IMR,
MMR.
MMR, formulas.
Under 5.
All right, doc. New RNTCP software online to monitor TB control program.
Share of this TB.
Nishchaya, Nikshaya?
Nikshay.
Nikshaya. Nirbhay, Nischay, Nikshay. Abba, abba. So who is the study unit of a ecological study? Sun. Longitudinal study, cross-sectional study,
Population.
then ecological study. Correct, very good, population.
Sir,
Longitudinal study, cross-sectional study, ecological study. कम से कम सीट नहीं आए तो कोचिंग कैसे देना आएगा? इट्स एक्सपीरियंस है. Longitudinal study, cross-sectional study, ecological study. In screening tests, out of 1,000 population, 90 were positive. Then gold standard test is done in which 100 was positive. Sensitivity. How do you calculate sensitivity? Sensitivity specificity का दो formula है. Positive predictive value का and negative predictive value का, and relation between negative predictive value specificity, positive predictive value and specificity एक बार लिख लो, पढ़ लो. Chemoprophylaxis for meningococcal meningitis. Famous question, old question. Toppers तो dump करेगा इसको. भरत नहीं है आज, अगर है तो वो would have massacred it. What is the answer? बोल. Rifampicin. Very good. Which is an active form of chlorination. हाँ लिख लो, chlorination compulsory आएगा. Chlorination. Once more, entomology. उसमें एडिस कैसे रहता है? राजकुमारी एडिस कैसे दिखता है? राजकुमारी एनोफिलस कैसे दिखता है? Which will lay down the eggs, which will be floating like boat, which will be laying down the legs underneath the water, which are day biter, which is night biter. उसका बोम्मा देख के, इमेज देख के रिकॉग्नाइज करना है. अगर एंटाइमोलॉजी को नहीं पढ़े तो और एक साल मच्छर काटते हुए बैठना पड़ता है सीट के लिए. Chlorination पढ़ लो. 33% is the chloride content. Ideal 1 hour is the contact period. Kala Azar is found in endemic in all areas except Assam, Bihar, UP, West Bengal में काला आजार रहता. Risk among exposed by risk among non-exposed is ये भी लिख लो. relative risk, attributable risk. रिलेटिव रिस्क को रिस्क रेशियो बोलते हैं, एट्रीब्यूटेबल रिस्क को रिस्क डिफरेंस बोलते हैं। 25 साल से यही टॉपिक पूछता है कंसिस्टेंटली एग्जामिनर। रिलेटिव रिस्क रेशियो రెండోది చదవాలి। పాస్చరైజేషన్ लिख लो, स्टैंडर्ड टॉपिक। व्हाट इज मेंट बाय होल्डर मेथड, व्हाट इज मेंट बाय फ्लैश मेथड, कितना टेम्परेचर यूज करते हो, व्हाट एजेंट्स will not die with pasteurization, everything about pasteurization. Ideal time gap between two live vaccines is
1 month.
1 month. Vaccines is standard. Susceptible person developed a disease within a range of 1 incubation period coming in contact with primary case, इसको क्या बोलते हैं? Secondary attack rate. मैंने बोला ना standard. Out of 100 women were offered OCP, 10 women got pregnant followed for 24 months. How do you calculate Pearl index? वो भी standard. आज रात की खत्म करो। Which does not cause hardness of water. Once more वो लिख लो। Hardness इसमें permanent, temporary. What agents will you use to soften the hardened water? Everything will आएगा कल के नीट पीजी में। टॉपिक लिया ना, टॉपिक समझ गए ना। डायरेक्ट ट्रांसमिशन ऑफ कम्युनिकेबल डिजीज व्हिच इज नॉट एन एग्जांपल।
Which of the following is not an example of direct transmission?
डायरेक्ट ट्रांसमिशन, सॉइल टच, प्लासेंटा टच, एसटीडी टच, नो टच। दिस इज प्योरली गेस, बिस्किट क्वेश्चन। वाटर्स व्यू मैंने कल बोला ना।
Maxillary sinus.
हाँ कल बोला ना वाटर्स। अरे कम ऑन, डोंट टेल मी।
Sir, today's దా చెప్పారు, నిన్న నాకు కదా.
ఓల్డ్ దాంట్లో చెప్పానా? రాయండి, టౌన్స్ వ్యూ, వాటర్ వ్యూ, కాల్వెల్ లుక్ వ్యూ, ఇంకెనీ అదర్ వ్యూస్ ఉంటే అన్ని వ్యూస్। కాల్వెల్ వ్యూ, టౌన్స్ వ్యూ, water view, all views on paranasal sciences is what you need to remember. ट्रेकियोस्टमी लिख लो। हाई ट्रेकियोस्टमी, लो ट्रेकियोस्टमी, जनरल ट्रेकियोस्टमी किस लेवल पे करोगे?
High tracheostomy is foreign body.
Which is a thickened nerve which is being shown to you. Calval view is used for ఎందుకు? काल्वल लुक्स ऑपरेशन किसको करते हैं? इसको। मगर काल्वल व्यू इज फॉर फ्रंटल। astigmatism in immetropic eye of elderly person कितना होता? 3 diopters. It will contribute. 100-day ग्लाकोमा किसको बोलते हैं? सेंट्रल रेटिनल वीन ऑप्टो। मैंने बोला ना, लिख लो, CRVO वर्सेस CRAO कंपलसरी आएगा। एस्टिग्मेटिज्म, मायोपिया, हाइपरमेट्रोपिया कंपलसरी आएगा। रिवीजन करना है आज रात की। అన్ని మీరు ఇట్లా పెట్టుకోవాలి, టిప్స్ లో పెట్టుకుని పోవాలి పరీక్షకి। It's not something that unexpected things don't come, expected things only will come. It's a known devil, right? Time pass mat karo, please. If your intention is to time pass with Vinisha, don't come to center, stay in home. But if you come with clear plan. No, that is very important, doctor. When you are preparing for exam, who is interested? मैं पहले दिन ही बोला, Diksha is seriously interested candidate. She mean business, nothing less, nothing more. Girija, business, pure business. But some friends we meet who fundamentally it's a good passing time. No, it's okay if it is April, May, June and all that. Now means Business, only business, purely. Don't you have trust on my strategy?
Of course.
हमको कितने दिन बाकी है? 28 है रेप
5 years. 20 today is 27, sir.
today रेप 28 March 1st 2nd 3rd 4th करेक्ट. ऑलरेडी कितना टॉपिक्स हो गया? अराउंड 150 होगा. ये 150 को आप गर्मा गर्म रेडी कर दिए तो मैं रोज एक 100 देता हूं. 2800, फर्स्ट को 100, सेकंड को 100, 100, फोर्थ को नहीं देता हूं. So 1, 2, 3, 4, 400 plus 150, 550 plus already yesterday 50 प्रेसिपिटेट किया. आज कल का प्रेसिपिटेट मिला है तो आज 150. 150 plus 400, 550 अम्मा. 550 से आपको 100 नए आए तो मैं कान काट लूंगा. Understand? Automatically it will come. And you should get that kind of brevity. There are some things I know. SPM completely clean bold है for example. Tension नहीं है. Selectively पढ़ के जाओ. At least 30-40 topics selectively. बोलो. Rot spots are seen in लुकीमिया में होता है, इन्फेक्टिव एंडोकार्डाइटिस में भी होता है रॉट स्पॉट्स. योक मसल ऑफ राइट लेटरल रेक्टस इज
Right lateral rectus is opposite chest.
చెప్పండి.
Yoke is both look into one direction. Left medial rectus.
दिल से सलाम. सिवियर कंजंक्टिविटिस caused by
Severe. नहीं, इसमें
गेस करो.
hemophilus. Streptococcus or staphylococcus.
गनोरिया में बच्चों में होता ना, क्रीड्स मेथड बोलते, सिल्वर नाइट्रेट इंस्टॉलेशन करते, which is a simple myopic astigmatism among the prescriptions given below. Will you give plus or minus? आज जब पढ़नी
Myopic అంటే పెద్ద minus ఇస్తారు.
మైనస్. కాబట్టి ఏం పెడదాం ఆన్సర్?
అదే D.
ప్లేనా స్పియరా?
తెలియదు.
ఆస్టిగ్మాటిజం అయితే స్పియర్,
Sphere.
ఇదైతే ప్లేన్. సో ప్లేన్ నెగటివ్.
Question by astigmatism.
Simple myopic
ఆస్టిగ్మాటిజం కూడా ఉందా? ఓకే.
ఇది రెడ్ లైట్ వేసుకుంటాం సార్, చాలా కన్ఫ్యూజన్.
Blowout fraction of orbit involves
Flow.
flow. But it's a standard topic. Commotio retinae, blowout fracture में what are the other features?
Blowout fraction
Sorry, that comes under blunt injury. I'm getting confused. Blowout fracture of orbit अलग है. Blunt injury of the eye, उसमें commotio retinae होता है, बहुत चीजें होता है. और sympathetic ophthalmitis लिख लो, standard topic. Then retinitis pigmentosa, retinoblastoma, जरूर आएगा वो दोनों. Now, which type of retractor is shown here? Morris retractor. Suture material in the image. It is degraded by enzymatic. लिख लो. Different types of sutures अम्मा. Absorbable, non-absorbable. Van Nuys prognostic index में क्या क्या होता है? Breast carcinoma is one of the favorite topic ना. Everything in the world possible on breast carcinoma पढ़ना. Compulsory, at least 2 questions will come. One from pathology, one from surgery. Common cause of chronic pancreatitis? Alcohol. So लिख लो acute pancreatitis, chronic pancreatitis, compulsory one question आएगा ये दोनों में, acute pancreatitis and chronic pancreatitis. Keloid versus hypertrophic scar, compulsory एक question आएगा, hypertrophic scar. Standard, it contains growth factor. Which layers are cut in fasciotomy? Skin, subcutaneous, superficial fascia and deep fascia. It is purely red line.
Cats, gaps in several levels. Important.
అంటే అబ్లికేటివ్
అది full thickness graft రాయండి. Full thickness graft, partial graft, where will you use them? That is, what is wolf graft, what is Thier's graft? वो सब graft तो पढ़ना है, but fasciotomy में क्या करते, myotomy में क्या करते, किसको मालूम है? This is compulsory. Crohn's versus ulcerative colitis. Compulsory एक क्वेश्चन आएगा.
which is not continuous it's division.
Skip. Crohn will skip to reach the mouth. Ulcerative colitis can't skip, so remain with colon. అమ్మ దేనికుంటే మాకు తెలియదు. కాబుల్ స్టోన్ అపియరెన్స్ దేంట్లో ఉంటుంది, చదవాలి. एक बार सर्जरी में बोला, मेडिसिन में बोला, पैथोलॉजी में बोला, बोलने के बाद भी कार्सिनोमा पैंक्रियास राइट, कार्सिनोमा पैंक्रियास कंपल्सरी वन क्वेश्चन आएगा 550 लिस्ट में. ఏముంటుందమ్మా కార్సినోమా ప్యాంక్రియాస్, how will be the clinical presentation? If it occur, what is Curvoiser's law? Then what is Whipple's procedure? What will you resect during Whipple's procedure? What are the tumor markers, whatever? So carcinoma, head of the pancreas, right? Then abdominal mass best demonstrated in congenital hypertrophic pyelonephritis. लिख लो CHPS. राइट, कंपल्सरी टॉपिक. जरा खिलाए तो वो प्रोमिनेंट हो जाएगा, क्योंकि वो वहां रुक जाएगा ना. सो विजिबल पेरिस्टाल्सिस दिखता है आपको. CHPS. Calculate GCS. అమ్మో అది రాయండి. Glasgow Coma Scale is a favorite topic among prognostic. ఇదొకటిను child Pukes classification. Child Pukes classification of cirrhosis. Glasgow Coma Scale. Ranson's criteria. ఈ మూడు ఇండెక్స్లు అబ్గార్ స్కోర్. ఇందులో అసలు नो डबुक डुबुक, श्योर शॉट आएगा. GCS, चाइल्ड प्यूब, रैंसन्स, अबगार, हॉट टॉपिक्स फॉर एग्जामिनर. ठीक है. तो रेड प्रोटो ऑन्कोजिन इज एसोसिएटेड विथ, लिख लो थायराइड कैंसर, कंपल्सरी 1 MCQ. So do you think that जो पढ़ा है ना, कितना दिन, 15 दिन पढ़े तो भी ये सब मुट्ठी में आएगा. उसके लिए ये पेपर, कुछ पेपर है क्या आराम से, बट वी डोंट डू दैट अनफॉर्चुनेटली. सो डॉक्टर, इट इज मेडुलरी कार्सिनोमा ऑफ थायराइड में फेमिलियल वेराइटी रहता, उसमें रेड प्रोटो ऑन्कोजिन विल बी पॉजिटिव. कट ऑफ सर्जरी फॉर एब्डोमिनल aortic aneurysm in asymptomatic patients. What is the most common presentation of abdominal aortic aneurysm? Asymptomatic. Elderly man को अल्ट्रासाउंड करे तो वहां निकलेगा. Unless the size is more than 5.5, you don't touch it. और एक बार लिख लो, dissecting aortic aneurysm, इसमें डिबेकी क्लासिफिकेशन, स्टैनफोर्ड, डिबेकी एंड स्टैनफोर्ड क्लासिफिकेशन, और abdominal aortic aneurysm. जरा 10 points will be there maximum. जरा खत्म करो. See, the advantage for you all is अगर आप स्कोर ऐप में जाके ये टाइटल मारे तो भी आपको मिल जाता पूरा माल, right? Good. Meghavi Patel, Kamini Sakore. Meghavi said Berlin sedima, commotio retinae. Very good. In blunt trauma of the eye. Understand, doctor? People are hungrily preparing, doctor. पेट में भूख और दर्द के साथ प्रिपेयर हो रहे, दिल में दर्द और पेट में भूख के साथ प्रिपेयर हो रहे. एक मार्क भी गए तो गया, that too from standard topics in अगर गए तो. D. Quervain stenosynovitis. This is a standard topic. लिख लो. D. Quervain stenosynovitis. Abductor pollicis longus and extensor pollicis brevis. Patient 2 years back had a history of road traffic accident. He developed pain and swelling. X-ray is being shown to you. Chronic osteomyelitis. Once more osteomyelitis लिख लो. Standard topic है acute and chronic. उसमें Gary's osteomyelitis क्या होता है? Similarly, septic arthritis is a favorite topic of the examiner. Septic arthritis. What organisms will lead to it? How will be the gonococcus is very common organism leading to monoarticular septic arthritis. Osteomyelitis में acute and chronic गर्मा गर्म पढ़ना. And what is meant by perilunate dislocation? So two things, doctor: scaphoid fracture, lunate dislocation, Colles fracture, Smith's fracture. Then Ronaldo's fracture. Right? So these 5 fractures जरा ए hand में याद रखना what exactly each of them are. Lunate dislocation, scaphoid fracture, Colles fracture, Smith's fracture, and Ronaldo fracture. What is meant by boxer's fracture? Clear? So lower radius, scaphoid and capitate are in alignment. Lunate alone is knocked out itself. Identify the bone numbered in X-ray that most commonly fractured when a person falls on outstretched hand. So you should know outstretched hand में Colles होता है. Fallen fragment sign. So please remember, aneurysmal bone cyst and simple bone cyst is a part of regular question bank. Fallen fragment sign in simple bone cyst. You are posted as an intern in casualty. Which fracture will be your first priority to call orthopg and inform? Patient finger is blackening. This is what purely common sense. बिस्किट बिस्किट है ना, बिस्किट. टेंशन में कुछ लोग बिस्किट को भी रॉन्ग करते. सी टेंशन एंजाइटी जो होता है ना एग्जाम का, इट इज लाइक ए क्वागमायर. आप ज्यादा टेंस फील हुए तो और नीचे डूबते जाओगे. ठंडी दिमाग से, राइट? Rheumatoid arthritis, which type of cell is predominantly present? మళ్ళీ ఇదొక సావు. ఇంత ముందు ఏది జీనోగ్రాఫ్ లో ఏ సెల్, ఈడ ఏ సెల్ చెప్పండి. We use infliximab like drugs, no, which are TNF alpha inhibitors, no. TNF alpha is important for उसके वजह से granulomatous disease will worsen. అన్నావా? Okay. 8th and 9th rib costal cartilage forms in which joint? Type of joints. Type of joints, you remember now? చదవాలి అవన్నీ. పివోట్ జాయింట్, గోంఫోసిస్ అంటే ఏంటి? ఇట్స్ a synovial joint.
Joints.
टॉम स्मिथ सेप्टिक आर्थराइटिस, इस सेप्टिक आर्थराइटिस इन्फेंसी में जब होता है ना, पूरा वो डिसॉल्व हो जाता फिमरल हेड, इट विल वैनिश. हाँ, इसको क्या बोलते हैं? टॉम स्मिथ सेप्टिक आर्थराइटिस. Which fontanelle is last to close? So जरा కొంచెం pediatrics రాయండి. Fontanelle compulsory. Which enzyme deficiency Lashkani-Khan? HGPRT. Other day, what did they ask? Hypoxanthine adenine phosphoribosyl transferase. Adenosyl. If purine metabolism में होता बोल के, you remember? Which vaccine not included in Indradhanush mission? Japanese encephalitis is not included. CT scan image. What condition?
Subdural.
Daddy okay. Well, last condition. Arnold-Chiari malformation type 1 and type 2. And Dandy-Walker malformation. What is most common cause of neonatal blindness, doctor?
Vitamin A Chlamydia.
ఇప్పుడే చెప్పుకున్నాం కదా, గనోరియాలో సివియర్ కంజంక్టివైటిస్ వస్తుంది. క్రీడ్ మెథడ్ అంటారు దాన్ని. సిల్వర్ నైట్రేట్. ఇప్పుడు ఇవన్నీ చెప్పండి గట్టిగా. షోల్డర్ డిస్టోషియా.
90 sharp section of hip joints towards abdomen. Section of hip joints towards abdomen. Red Roberts.
Suprapubic pressure.
First suprapubic pressure.
Macrobird's maneuver.
There is Macrobird's లో flexion ఉంటుంది.
అవును.
Goods లో 90 degrees ఇట్లా రొటేట్ చేసి ఫస్ట్ suprapubic pressure.
ఐడెంటిఫై ది ఎక్స్రే ఆన్ హెచ్ఎస్జి. మీరు ఒక్కటి గుర్తుపెట్టుకోండి అప్ప, हिस्ट्रोसैल्पिंगोग्राफ में ऑल मुल्लेरियन एनॉमलीज को रिकॉग्नाइज करने का प्रयत्न करो. अल्ट्रासाउंड गूगल इमेजेस में मिल जाता आपको. सेप्टेड यूट्रस क्या होता है, यूट्रस डाइडेल्फिस क्या है, यूनिकॉर्नुएट यूट्रस क्या होता है, राइट. एवरी नीट पीजी में एक HSG ऑन मुल्लेरियन एनॉमलीज कंपल्सरी दे रहे, एग्जामिनर कंसिस्टेंटली दे रहे, बराबर. और मैं कल क्या बोला, एंड्रोजन इनसेंसिटिविटी, टेस्टिकुलर टेस्टिकुलर फेमिनाइजेशन, मेयर रोकेटान्स्की कस्नर हास्नर सिंड्रोम, हर्माफ्रोडाइटिज्म, कंजेनिटल एड्रिनल हाइपरप्लेसिया. कल के लिस्ट में है ना, जरा गर्मा गर्म पढ़ो. ट्रू hermaphroditism में 46XX, but ovo testis will be there. Nowadays they removed all this terminology. They are no more calling hermaphrodite because LGBT intersex, they have their own rights. क्या रे, हम बायोलॉजी हेन के जैसे दिख रहे हैं क्या, नहीं तो कॉक के जैसे दिख रहे हैं क्या, कमान बोल के they are suing the gynecology association. Peripartum cardiomyopathy occurring. Purely red light question. You can't guess within 5 months. Nerve most commonly compressed in pregnancy. Huh? Femoral nerve. In pregnancy, which level is altered mostly?
In pregnancy, which of the following level is altered mostly?
Free T4. Paget's is associated with vulval cancer. Paget कहाँ होता है? vulva में होता है. So vulval cancer, vaginal cancer, carcinoma cervix, carcinoma endometrium, ovarian cancer. Enter gynecology वही है ना, उसमें भी wrong करे तो कैसा? Superfecundation means, once more, twin pregnancy is a very, very high yield topic. So it is fertilization of 2 or more ova in different intercourses in the same menstrual cycle. Fetal heart start contracting at 3 to 5 weeks.
That's good.
Anesthesia of choice for cesarean in severe. गाइनाम्स उतना बिस्किट टॉपिक सब्जेक्ट है 30 को 30 मार के निकलेगा हमारे गुंटूर आंध्र मेडिकल कॉलेज गन्स। अगर आप अभी अभी प्री क्या है, एक्लेम्सिया क्या है, पोस्ट भी होता क्या बोल के बैठे तो नहीं होता। बोलो एपिड्यूरल, which is not a high risk pregnancy.
Previous is
Manual removal of placenta previous is not included in that list,
because it is after delivery.
which is not used in preeclampsia. लिख लो eclampsia, preeclampsia, gestational diabetes, standard topics. There is nothing surprise in obstetrics and gynecology. HELLP. Dilatation, curettage, DNC contraindications. Huh?
Endometriosis, pelvic inflammatory disease, none. Ectopic congestion,
PID है तो DNC कहाँ करते भाई? Which is correct regarding placenta. Placenta and types of placenta. Placenta previa, placenta accreta, placenta percreta, placenta increta, and everything about the placenta. You should be good. So, placenta has Wharton's jelly. Placenta has 2 arteries, not 1 artery. Acute fatty liver, ఇది రాసుకోండి. Acute fatty liver, then cholestasis of pregnancy, then PUP, PUPP. Compulsory one question will come from this. Which will come in first trimester, what will come in third trimester, which will recur, which will not recur in the future pregnancy. Prognosis क्या होता है? All these things about these 3. Establishment of feto-placental circulation is seen at 20 to 22 days. Till then, your progesterone will be helping. Corpus luteum से बना हुआ. So tomorrow we'll take the remaining. Right, doctor? Good to see 47 online classmates for this wonderful session. So now quickly, abhi niklega. What are the topics we precipitated, which you are going to read and come tomorrow? Please WhatsApp me any of these topics you want me to once more create a 5-minute, 10-minute video. बनाना है तो बोलो, आप अपने आप पढ़ने में दिक्कत हो रहे तो मितना आप सबको हैंड रिटन टॉपिक लिस्ट अभी पोस्ट करेगा व्हाट्सएप ग्रुप में. अगर व्हाट्सएप ग्रुप में नहीं है तो अभी व्हाट्सएप ग्रुप में ज्वाइन हो. ज्वाइन होने के लिए मैंने नीचे लिंक भिजाया, वो लिंक से ज्वाइन हो जाओ. बोलो बेटा, फास्ट फास्ट. అరే నువ్వు టక్ టక్ మని చెప్పు, కొన్ని చెప్పు ఫాస్ట్. అన్ని తర్వాత పెట్టమ్మా. ఎఫేసియా, lumbricals,
all
cardiomyopathies, Brugada syndrome,
advanced cardiac life support,
advanced cardiac life support and basic cardiac life support, CPR,
vasculitis,
vasculitis, compulsory one question.
Stroke syndrome, sir. Stroke syndrome.
Stroke syndromes in brainstem. అట్లా రాయండి. ACA, MCA, PCA, then medial medullary syndrome, lateral medullary syndrome, Wallenberg, everything. Myasthenia and Eaton Lambert,
complement hypersensitivity.
Hypersensitivity, complement cascade,
Bernard Solier,
Bernard Solier,
Glanzmann,
Glanzmann, and von Willebrand.
hemolytic reactions after transplant.
All about hemolytic anemias, cold, warm, PNH,
Transplant immunology,
transplant immunology, transplant infections in that early infections, late infections, all the immunosuppressive drugs and transplant.
Bartels, Gordon's, Liddell's, Titleman, Fanconi.
Already Atul Sharma, I love you बोल रहे अब अतुलिता है तो I would have enjoyed it, but anyway I can live with this. So Mithuna, जरा वो list डालो बेटा, और you will get more love signs by that. Huh? So very good. Thank you all for attending today. रोज मिलेंगे, रोज पढ़ेंगे next 5 दिन में. But please remember, don't do anything else. Just finish this list. स्कोर ऐप में जाओ, सर्च में जाओ, ये वॉन विली ब्रांड डिजीज डालो, इमीडिएटली पूरा एमसीक्यूज नोट्स आएगा. बर 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 बुर 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 रिवीजन करो. हाई एनर्जी में काम करेंगे, सोएंगे नहीं, जागेंगे. 1 घंटा सोएंगे बिकॉज बॉडी नीड्स.
Last year's subjects to English.
If somebody advises you, sleep early, get up, do meditation, वो सब bullshit and बकवास है, वो सब अभी नहीं होगा, right? अभी खाली एक चीज होता है, पढ़ो पढ़ो पढ़ो, जब थक गए हो सो जाओ, ज्यादा टेंशन है तो थोड़ी देर के लिए क्राई, वॉश द फेस, फिर बैठ के पढ़ो, क्योंकि the only medicine, all this anxiety, stress is the driving force, doctor, essential evil, right? Thank you very much.